So fibromyalgia is actually a chronic pain condition, and it's actually quite common. So it does affect about 1 in 20 people. Okay, so you can say the ratio between 4 to 10%. And it's to make it more simplified, it's a widespread pain. It's chronic, which means it's happening more than 3 months. It's not only about the widespread pain as well. It does affect the sleep. So most of the patient will tell you we cannot sleep well. It does interact and interrupt our sleep. They feel tired as well all the time, which means it does affect their daily activities. The more interesting thing, they'll tell you our memory is being affected. And that's, they notice this when they're looking after their kids, and if they are working on a daily basis, so start to forget something. So it does affect the memory, it does affect the sleep. It give you pain and fatigue all the time. And sometimes as well, it's associated with some other symptoms, which we call it somatic symptoms. Like, they'll say we have headaches, we got abdominal pain and cramps, we got irritable bowel syndrome, which, initially we looked at it, it's like how this can be related to fibromyalgia, but actually that's part of the fibromyalgia. To summarize it, it's a chronic widespread pain, which does affect the sleep, make you tired all the time, does affect your memory and give you some other symptoms as well. And it's been there are specific scoring system to diagnose. We try to simplify it to everyone, but there's a very specific scoring system which is being put out by the American Rheumatology College, actually. That's a very interesting question, because lots of people ask, okay, what is the reason of the fibromyalgia? How I get it? Is it is it like an infection, or is it like something which is autoimmune, or it's like any it's like high blood pressure? Well, actually, it's a bit different. Okay, so we don't know the exact reason why fibromyalgia happening to some patients and not to other patients. But what we know about the risk factors. So we know about the factors which we have seen commonly in many patients with fibromyalgia. Okay, so so first of all, fibromyalgia run in families. So you see it quite often. A young lady in her 20s coming in the clinic, say, I got fibromyalgia, exactly like my mom. Okay, and we've heard this quite often. So it does run in families. There is a genetic input. The other thing, the stresses as well, which you pass through your life on daily basis, from work, from home, from anything, does fuel the fibromyalgia. So most of them, they will have a bit of depression or some sort of anxiety. The other factors, if there is a life-changing trauma happening in your life, say, what we call it, a psychological trauma, like someone who's quite close to you, or something happening in your life which does affect you. This can be a big factor to start the symptoms of the fibromyalgia. With a post traumatic stress syndrome patients, who have big event in their life, we've seen some of them later on will have some fibromyalgia symptoms. So there is no specific causes for fibromyalgia, but there are some risk factors which can lead to fibromyalgia. The other thing as well is the gender. So it's quite more in females, more than males. Okay, and as I said before, genetic factor, anxiety, and psychological trauma. So it is hereditary. It's run in families. There is a genetic input. We don't know the exact gene which related to fibromyalgia, but we know there is a genetic factor in fibromyalgia. Yes, so it's like all the chronic pain condition. Okay, so it's a lifelong condition, which is unfortunately, the patients will be, suffering from this, will continue. But it's all about, it's like the chronic pain condition. Okay, so it's all about how you will manage it, and that will affect. Yes, it will be a lifelong condition. Okay, but can you make it better? Can you make changes to make yourself coping, okay, with with all the things you do in your life? Can you get back to things which you like to do, your daily activities? Can you be a productive person if you are working? Can you work? All these changes we can make it to get you back to your, I'm not gonna say your normal life, but closer to your standard life before you get fibromyalgia. So that quality of life, okay, and that's how we manage it. So it's yes, it's a long life condition, but it is manageable. It can be managed to a better position. So as I was mentioning in the last question, yes, it is a long life condition, like most of the chronic pain conditions, but at the same time, it can be managed to get your quality of life. So first, I'd like to set what the definition of managing here. So definition of managing here is not definition of getting things curable, okay, but it's make it better basically. So get your pain control, get your pain scores less by more than 50%, get your quality of life better, go back to do your hobbies, be able to work, improve your psychology or how you're feeling. Okay, this is all the targets of the management. Okay, and then you ask me, okay, so how can we do this? Okay, so very big trial being done on fibromyalgia patients in the States, actually not in the UK, here in the States, because they have lots of fibromyalgia patients, more than 5 million there. And actually what they found, they compared different treatments and medications and different approaches to lifestyle, psychology treatment. And what they found out, yes, there are many patients who unfortunately been putting on lots of strong painkillers, strong pain medications, like morphine and all its derivatives. And basically those type of medications are not working. They come up with evidence of like 1 or 2 medications which got evidence to work in fibromyalgia. And then the more evidence as well is for the lifestyle changes. So they found people who did what we call it the pain management program, which is a mix between the psychological approaches and the physiotherapy approaches. And that actually helps to improve the patient lifestyle and quality of life. Okay, so those patients, they trained now to pace themselves, to know that lying, resting all the time is not going to help. They need to start do things, but how they do the things, they need to know how to pace themselves. So how to be active, but at the same time not to do it too much, do it in a sensible way. How to work, but adjust your work environment, okay, to make it works for you, not works against you. And at the same time, do the things which you like to do in daily basis, but in a sensible way. So it is that balance, okay, of the lifestyle and pacing. Plus, there are some other approaches as well from the psychological input, okay, like the cognitive behavior therapy and what we call it the ACT. Just basically try to change the thoughts, the wrong thoughts, which we think like resting all the time would help. That's not going to help. And how our view need to be changed about things which we do on daily basis as well, and how to get things moving forward and putting some goals and targets. Okay, so medications, lifestyle changes. Plus, for every fibromyalgia patient, there is a specific thing for him. Okay, like one of them will tell you, my shoulders really hurts and that affected me. Or, I got lots of cramps in my lower back or in my hands. So I tailored as well the treatment or the management according to every patient. Some patients will need a bit, maybe 1 or 2 interventions to help them getting pain-free and be able to move better the shoulder or their knees or their hips. Okay, so some of them will need some specific treatments, okay, for completion to get them back to life. So to summarize it, medications, yes, there are 1 or 2 medications which can help, but more to help is the pain management program and your lifestyle changing and know yourself better and what can I do and what I cannot do. Plus, lastly, the specific treatment which I will offer according to every patient condition, and then just get them back to life, improve their quality of life they're getting. I found most of my fibromyalgia patients, not after 3 months, after maybe 6 months, they start to feel the difference, and after a year, they can tell you, I'm a different person.